Adesso ci sarà un altro contributo della dottoressa Antonella Alberici, che parlerà in particolare di quello che è accaduto durante il periodo Covid nella città di Brescia, che è stata una delle città più colpite nel mondo. Now there will be another video contribution from Dr. Antonella Alberici of Spedali Civili in Brescia. Brescia was one of the city in the world that had a number very enormous of COVID infected, and we had very, very big problems, and the problems of people with FTD during COVID were also harder. So if you can, and we can send the video, thank you.
I will. Thank you, Laura.
The general management that we provide for FTD patients and their caregiver in Brescia is usually assessed in an outpatient clinic. So in these outpatient clinics, we provide a fully neurological examination, a psychological assessment, and for selected patients, so for those who has a positive family history or young onset, also genetic counseling. For some patients, we also provide a sort of hospitalization for those who needs more assessment, clinical or specialized examination. And in Brescia also we have all the facility to assess MRI scan, FTG PET, or for some patients also to undergo to lumbar puncture for cerebrospinal fluid examination. Genetic analyses are available, genetic counseling and psychological support for some of them, for those who need it. In Brescia, during COVID outbreak, every outpatient clinic was stopped because we had to take care of a large number of COVID patients. We had the hospital Spedali Civili. It became a hub for every patient in the Brescia province and in Lombardy. Probably Brescia Hospital was the took care of the huge number of COVID patients. Some of us moved to COVID emergency unit to provide the care and emergency to COVID patients for respiratory problems or other outbreak problems. So our FTD patients stayed at home, and only emergency was guaranteed for these patients. But as soon as possible, also we started with telemedicine in order to provide support and care for every kind of therapy or suggestion. So with the COVID lockdown, we coped with the telemedicine. The hospital was stopped to any kind of clinical activity for any kind of patients apart COVID patients. We moved the hospital, moved every activity with a huge number of COVID patients. But we guarantee our support to patients and their caregiver by telemedicine. This was the first step. The second step was that we started a research program in order to identify which was the coping of patients and their caregivers with the lockdown, and we started with video or phone calls by our psychologists to these families in order to understand with the questionnaires their burden. And this was quite interesting because, of course, some of patients suffered a lot to being closed at home. Some of them could be also fined by legal problems about the lockdown because they wanted to go down, they can't stay at home, and so on. But there's also to underline that For some of the caregivers, it was a great help to have their children at home because of sharing the caregiver burden with other family members. So it was quite clear that some of the caregiver had some help for those who were not at home usually, but were constricted at home for the lockdown, and this was another way to understand that there is a great need to support patients and their caregivers in this disease. Now the outpatient clinics is open. The hospital is running again a normal activity with some new rules about distancing in order to guarantee any kind of security to the patients and their caregivers. So we already opened our activity and we guarantee an access to every kind of patients. Of course, we have a lots of work to be done that was not done in the past times, and we have to move to work hardly for the next few months. At personal level, to communicate the diagnosis of FTD is very hard. It's a work that I learned during this long time of experience, and every time is like a new time. And personally, I'm telling always the truth to patients and their caregivers, also for the genetic families and genetic patients. That's the mostly hard work, but with a sort of looking forward to the possibility to find not only a diagnosis now, but a sort of therapy in the future, in the next future, or in the future that will be that has to come. And sometimes I need help for this work, and I try to have help from my colleagues or psychologists, but I hope to do my best. So after the disease, what I suggest to the patients and their caregivers is not to close in their houses, to open to the diagnosis to their other family members, and to share their pain and their burden to not only with us that are their doctors and psychologists, but also to the society. So the people has to know about this disease. The knowledge about this disease has to be shared, because with the knowledge also the pain and the great effort that this disease requires during the time could be shared and could be alleviated. And the diagnosis is just the beginning of a long path that we as doctors, neurologists and psychologists would like to share with the patients and their family members in the perspective not only to tell what is the disease, but also to find a future cure definitely for this frontotemporal dementia disease.
I want to really thank Dr. Antonella Alberici because I asked her a lot of questions, and I know how much it is difficult for a doctor who is a scientist to be also human. And we are very lucky, I think, not also here in Italy, but as I see in Holland and in UK, and also in Australia and United States, because we have found sanitary operators that are very human, very sensitive, and it's really important because for example, the Italian association is an association of families, and we all have a person in our family that has FTD. But this experience teach me, I think teach all of us to be resilient, because although we have to fight every day with this disease, I had also the opportunity to do something that I never think I would do. Voglio ringraziare moltissimo la dottoressa Alberici perché so quanto è difficile per uno scienziato, per un medico, essere anche così umano e sensibile. E in questa malattia è veramente importante la vicinanza di chi ti fornisce la diagnosi. Siamo stati fortunati con l'Associazione Italiana Malattia Frontotemporale in Italia, ma da quello che ho potuto vedere in questi mesi che abbiamo preparato la marathon insieme all'associazione olandese, all'associazione inglese ed anche a quella australiana e americana, abbiamo avuto a che fare con degli operatori sanitari di grande sensibilità. E una cosa che secondo me è molto importante è comunque pensare che anche se siamo familiari, l'associazione italiana è nata da delle famiglie, l'hanno fondata Silviana Morsone e Marco Cola insieme ad un'altra famiglia perché si erano trovati da soli in un momento di estrema difficoltà e hanno potuto dare conforto alle persone. E io stessa li ho conosciuti nel corso di un incontro con i familiari e mi sono resa conto che questa malattia mi ha dato anche l'opportunità di fare delle cose che mai avrei pensato di fare, come per esempio intervistare i più grandi ricercatori riconosciuti in tutto il mondo nelle piazze della città di Brescia. E quindi credo che sia molto importante che la resilienza, che ci sia questo modo di vedere le cose comunque positivo, perché anche se abbiamo a che fare con la malattia, però non siamo noi malati, ma possiamo fare tutto quello che è necessario per aiutare chi la ricerca la fa, chi le diagnosi le fa, ad aiutarci nel modo migliore. Another thing that I want to talk about is about the marathon idea. And the graphic of the marathon, I'm pleased to tell that is from our Italian graphic designers. They are two young guys, Chiara Facciolo and Enrico Geller. And they had a aunt that was ill of FTD, and they decided to do their thesis in FTD, and they had the extraordinary way to see the FTD with the images that are not sad or heavy, but they are fresh, they are young, and they give the idea of hope. And I think that hope is really important, although if there is no hope, because the attitude is so fundamental. We will see in the other videos contribution that the attitude and also the environment is really important to fight the FTD. For example, I talk about me because it's easier, but I had to refresh my English. That is not very good, but I think that it will help me with fighting against FTD if there is if I have to. Vorrei parlare anche di quello della grafica di questa maratona, dell'idea della maratona. Sono orgogliosa di dire che la grafica, la locandina della maratona arriva dai nostri graphic designer, che sono due ragazzi molto giovani, italiani, si chiamano Chiara Facciolo ed Enrico Geller, e hanno realizzato questa grafica che non dà un'idea di tristezza, di pesantezza, di malattia, ma è una grafica fresca che dà speranza, che fa sentire le persone con un'attitudine positiva, anche se magari di speranze non ce ne sono. E parlo di me perché è più semplice, ma è molto importante anche quello che noi possiamo fare per non solo per aiutare i nostri cari che sono malati, ma anche per prevenire la malattia nel caso si tratti di una malattia, di una mutazione genetica, perché per esempio io mi sono ritrovata nel ruolo di vicepresidente dell'associazione a dover rinfrescare il mio inglese, che purtroppo non è un granché, però credo che mi aiuterà a mantenere il mio cervello il più allenato possibile. E quindi ecco, penso che in ogni circostanza sia importante comunque avere un'attitudine positiva. And I also want to tell another thing about our video maker, Stefania Vialetto. She was really, really great, because we had to record in squares full of noises, full of people, full of curious, and she made a perfect job, not only because she is very, very, very good technically, but she has a very great heart. So I want to thank her in specific. Un'ultima cosa che vi voglio dire è che voglio ringraziare moltissimo la nostra videomaker Stefania Vialetto, perché l'ho costretta a lavorare in una condizione difficilissima, in mezzo a piazze piene di persone, piene di rumori, con il trapano. Abbiamo dovuto registrare tantissime volte e lei ha realizzato un lavoro veramente eccellente, e non soltanto perché è una persona tecnicamente ineccepibile, ma soprattutto e anche perché ha veramente un grande cuore, e credo che questa sia un po' la filosofia di questa maratona. So thank you for listening to me, and now I leave my other colleagues to the other contribution. Thank you, Enrique, thank you everyone.